All right. Welcome, everyone. It's nice to see so many of you. Welcome to this webinar, where we have the opportunity to meet and learn from Dr. Gaurang Gaikwad. So let me introduce you to him first. Although he considers himself quite an ordinary homeopath, we found that he is actually a very popular teacher with an impressive curriculum. Not only does he teach many students and practitioners internationally, he is also the author of at least 4 books. Tonight's topic is Nosodes and Sarcodes, and yes, he has written a book on that topic too. But I think what's even more important is that Gaurang, through his unique journey of exploration, can guide us in prescribing and understanding the deeper levels of these remedies. This webinar serves as an introduction to his seminar in November in the Netherlands, taking place on November 13th and 15th of this year. He'll be flying all the way to the Netherlands to explore this subject with us in depth. So if you're interested in being a part of the seminar in November, you can register on the website of the Academy for Social Homeopathy in the Netherlands. I'll post the link to that in the chat right away. And this seminar can also be attended online. So welcome and thank you, Gaurang, for spending time with us tonight. The floor is all yours.
Thank you, Judith. And thank you to all my friends who have joined tonight. So I think we can start, Judith. And I think I have roughly about an hour time, you think? Yes.
I thought an hour and a half. You did?
I'm happy with an hour and a half also.
In total, 1.5 hours, yes.
Yes. Perfect. So, well, good evening. And I'm just wondering if we can, how do we start? I think we have a mix of so many colleagues from different parts of the world. I'm going to straight away jump to our topic. So the topic is about today's times. And we are talking about complex cases. We are talking about today's cases are much more complicated. They are much more obstructed, blocked due to a variety of reasons, including the allopathic medicines in today's times, including steroids, the immunosuppressants, the vaccinations, the radiation and the electricity and the mobile radiations, the laptop radiations, the lifestyle, the pollution in some countries, the transgenerational pattern. So all these things really make many of our cases in a kind of a block state. So very often we find a remedy so well indicated. We feel this is the remedy, you know. But you give the remedy and there is no change. I'm sure that so many of our colleagues who have joined, so many experienced homeopaths, some of them my colleagues, some of them teachers, some of them my friends, some of them will be my friends. You all have such cases. And I'm sure, at least in my practice, has quite a few number of cases in the last few years. So I've just made a small map here. If you focus here, I will follow it up with some cases. So what do we do in blocked cases? Right? I have tried to put together a bit of a map that you can see. in a stuck, blocked case, what are the different strategies that I often use? One of the strategies, of course, is the Hahnemannian strategy, the strategy that Master Hahnemann himself used. He studied the deeper miasm. He tried to go much more deeper, and he tried to understand what is at a much deeper level. He studied the miasms. He studied the miasm deeper to the case and basically prescribed a remedy that covers the miasm. In many hormonal cases, in many cases, you will see there is a lot of hormonal layers to a case. Many of such cases require Sarcodes. We will, of course, talk about this so much in detail. In many cases in today's times, you will see also that there are many allergies. There are many food allergies. There are many autoimmune diseases. There are many cases where the gut is affected so deeply that the case is so much more blocked. In many such cases, you might have to consider a bowel nosode, or what you call as the intestinal nosode. In many cases, you might see a history of a lot of exposure to radiations. For example, in an oncological case, you might see after a lot of radiations, there's a lot of side effects. Here you can consider remedies like the imponderablia group of remedies like radium bromide, X-ray, uranium nitricum, plutonium nitricum. In many cases, there are addictions. History of a lot of addictions, food addictions. For example, a lot of tobacco addiction, a lot of smoking, a lot of tobacco chewing, and that blocks any remedy that you give because the patient has been eating tobacco for last 30 years, 10 times a day. So there's an entire layer of tobacco poisoning in that way. Here you might want to consider remedies prepared from it. A remedy like lobelia or tobacco or nicotinum. We also have a remedy, nicotinum. In certain cases, there's a lot of allopathic medicines taken. And that might actually cause a lot of side effects. Here you want to consider tautopathic medicines. So this is the long and short of the entire talk that I'm going to have today. But of course, we're going to start off with a case. Let's start with the first case. So this is a case of a young boy. He's a 16-year-old boy. He has an ingrown toenail. Okay? And of course, we all know what's an ingrown toenail. I'm going to just show you a picture of the patient. And I hope that I'm going to just ask my colleague Judith to see if the screen is visible and the picture can be seen. Yes, it is visible. Perfect, because it's a little hazy for me, so I'm asking. So this is our patient. He has this ulcer, this pain, this bleeding, this ingrown toenail. Now, why is this case interesting? Is because all the remedies that you can think about, including the silica, including the heparsol, including the calcarea sulfuricum, all the typical remedies that you can consider for the ingrown toenail, because his family members are homeopaths, he has already taken. So what to do? Well, like every case, we still have to individualize the case. We still have to go deeper. We still have to find the remedy for the patient. So let me share with you, in summary, what we tried to do. The cases I'm going to present to you today are summarized because we have limited time. And I want to share many cases. Even when I come to the Netherlands, I'll try to find a way by which we can share many cases in shorter time. So how did his problem start? He had an infection in the right foot, toe, lot of pain, lot of discharge. And it all started 3 years back when there was an injury and there was a splinter that pierced his skin. And that's how it started. At this point, I want to tell you that I give a lot of importance to past history of complaints. So I'm asking him, tell me a little bit about what are the illnesses you have had in the past? And of course, our patient says that he had a lot of worm infestation. So there's a lot of gastric symptoms in him in the past, and especially related to the worms. So this is interesting. Now, why is this important? I'm going to tell you here. Here we go. I give a lot of importance to past history. Today's topic, as you already know, is nosode, sarcode, bowel nosode, so on. If you want to find the possible nosode, sarcode, bowel nosode that you want to consider in a stuck or a block case, a lot of importance has to be given to past history of illness. The soil is very important. The soil on which the disease is actually there. And there's a very nice book written by Phobister, okay, on past history and family history. Importance of family history and past history in homeopathy. Very nice. It's a small booklet by Phobister, and it's one of my favorite classic books. And it's one of my favorite thing to do during the cases. I like to share one or two of classic books which are rare and forgotten, because classical homeopathy is forgotten in today's times of a lot of contemporary ideas. And that's one of my calling to bring it back into fashion. So it would be very, very, very important to go into past history of illness. Why is it important? This was actually kind of shared by Master Adolf von Lippe. Adolf von Lippe, one of my favorite homeopaths of all time. And you know his very famous case of impotency, where he was once called to treat a complicated case of impotency, which was not improving, by another of his colleague whose name was Wesselhoff. And Wesselhoff was wanting Lippe to study this case because this particular gentleman was not improving. And Lippe studied the case and he said, there is no peculiarity. What to do? And that's when Lippe went into the past history of symptoms. And he found in this case that this particular gentleman had history of diphtheria many years back. And the peculiarity about the diphtheria was that it came on the left side and then on the right. So there was a lot of alternating sides. Based on this, Lippe gave lac caninum 45 m to this gentleman, and the impotency was cured. So now, why I'm talking about this, I'm taking you right back to the history of homeopathy. The reason, because if you want to move forward, you have to go back. You have to study back. You have to go back, understand really the history of what our masters really did, what is really missing in today's times. So this actually case is a very popular and a very famous case. And that's why Lippe is known as the Prince of Prescribed Herbs. Okay. And that's why, coming back to our case, and we are talking today about this case of ingrown toenail. He's in a lot of pain. There's a lot of bleeding. There's a lot of ulcers. And we found out in past history, he had a lot of worm infestations and he had a lot of diarrhea and a lot of gastric symptoms. Okay. Now we are trying to understand him a little more. So I'm asking him some questions. He loves meat, is something that he likes a lot. He loves chicken. Tell more. And he doesn't like heat too much. Hot weather is something that he doesn't like too much. What dreams do you get? One of the dreams that he gets is he's falling from a very, very high place. And he shouts and he screams and he wakes up. That's another dream. What is the feeling? I'm dying. There's a lot of nervousness. I feel very scared. I'm falling from a very high place and I'm dying. My God. That's his dream from his subconscious state. Tell more. What else are your fears? I have a lot of fears of insects. I never dare go near them. Okay. Tell me a little bit about yourself, your basic nature, temperament, personality, in few words. I always want to be in top of my class. I want that, somehow everyone should know about who I am, how good I am. For me, my image is very, very important, how I'm perceived. People should think very highly of me. People should think I'm a good person, I'm a good human being, and my image should be very, very high. I want that everyone respects me a lot. I want that students respect me. I want that teachers respect me. So what is the main stress? Now I'm also asking questions to the relatives in and around. One of the main stress is financial stress. So there's a lot of financial insecurity. He wants to earn a lot of money in future because money is directly related to what would people think of him. The image and money for him is directly connected to each other. Tell more. Tell more about yourself. He is very sensitive about respect and disrespect. He cannot tolerate disrespect at all. Tell me about your childhood. In his childhood, he was very, very shy and he couldn't talk to people. He had a speech related issues and he would stammer a lot. And he was very, very bashful, shy. If he would go on stage, he would have palpitations, he would be blushing, he would be flushing, he would get very nervous. Again, as a child, for him, what people thought about him was something of a big, big, big sensitivity. He's generally very anxious about his nature. His family members now tell us that he is very, very anxious, and as a child he would hide himself. He would go below the table. He would try to hide himself below the table. He would be so timid, so scared. In fact, he would get loose stools before exams and things like that. So now I've just summarized the case for you in short. What to do? Remember, he must have taken about 10, 15 different remedies. So he's definitely taken silica, calcarea sulf, hepar sulf, baryta calm, all the remedies that you can imagine. What to do? So I'll just try to share with you what I tried to do and what I learned in the case. That's the idea that. So the main thing, first of all, you need to understand is that a very well selected remedy like silica or baryta has failed. So my main idea here is that very, very important in this case is the importance of past history. The past history of worms, the past history of digestive problems, whenever he had kind of psychological issues. Now, this is a very important pattern. Why is this important pattern? Because in cases which are blocked, which are complex, which are not improving, when there is a mind and gut connection, there is a group of remedies which I use very, very often. And which is a remedy that I used, I want to tell you. I just try to repertorize the case. Okay. I'm going to try to repertorize the case for you here. Okay, step by step. Let me try to do it with you. Okay, this is a repertory. I hope you can see this repertory. Judith, is the repertory visible? Repertory screen is visible. Okay, I will try to do it with you step by step. Okay. So I start with the clear symptom of dreams of falling from the high place. Okay. You can see dreams of falling from high place. I hope you can see this rubric. This is the rubric. Normally, what I also do in the repertory, I'm going to show it to you. Yeah. And what I also do is I give a lot of importance to who is the author. What does it mean? Meaning, dreams of falling from high place has 61 remedies. Of course, we know the main remedy is Thuja, and it is given by Clark. Okay. Now, I give a lot of importance to authors and who have proved which remedies. For example, this is given by Clark. So, for me, there is a lot of importance for provings done by old classical homeopaths. Okay, so I give a lot of importance to it. So I read every remedy. For example, Thuja here is written, given by Clark. Digitalis is given by Farrington. Elapse is given by Kent. So you have to read every remedy like this, understand who has given it, who's the author, and if needed, you even go and read what exactly the author, the prover, or the clinician has written about that remedy in context of the symptom. So I would give a lot of importance to this while studying the rubric. Okay. The topic is Nosode and Sarcodes, etc. But I'm going to share with you a lot of different topics in between of that. So this is the first rubric I took. What is the next rubric that we saw? Let's see. The next rubric is very sensitive about what people talk about him. So the next rubric, sensitive to opinion of others or sensitive to, you can see here, what others say about him. I hope you can see this rubric also. Next rubric, he is very timid, right? Timid, bashful. You can see here, timidity. I can also go down and take a specific rubric. Timidity, bashful, right? And timidity, bashful, I can take in public. Even in public, he feels very bashful, for example. So much that he blushes a lot during that time. The next symptom is that when he gets very nervous, he passes diarrhea. So you can see diarrhea from emotional excitement. That's the next rubric for me here. So these are all group of rubrics that I've taken. Now, when I look at all these rubrics, what could be the possible remedy? So that's what I want to see. So when I look at it, very interesting. I hope this repertory sheet can be seen. And if you see here, there is a very interesting remedy that comes up. It's written DYS and then CO. And then the next remedy, of course, is Thuja we discussed. And next is carcinosin. And next is Ambra grisea. And there is silica here somewhere hidden. But very interesting is this remedy. What is this remedy? DYSCO. First, let's try to understand. So the name of the remedy is dysentery compound. Okay, let's go to the, yeah, this is the remedy. Dysentery compound. It's one of the 7 bowel nosode or intestinal nosode. It's prepared from Shigella dysenteria. Before we go into dysentery compound, first just broadly understand what is a bowel nosode. Now listen, today is a really like a trailer of the movie. Okay, so I cannot really go in really depth of what is a bowel nosode and how each bowel nosode is different and it's difficult for me to do that in 15 minutes. Okay. But I'm going to summarize it a little bit, like an appetizer to invite you to study and go deeper. And I'm going to suggest you books to read and how you can actually develop and understand all these newer ideas and older ideas and connect these ideas in your clinical practice. I will try to do that for you. So first, let's try to understand what is a bowel nosode, like a summary of it. So yeah, here we go. So a lot of a lot of current understanding show that there is connection between the gut and the brain. A lot of current understanding show that brain and the gut is deeply connected. So much so that the brain is known as the rational part and the gut is known as the emotional brain. Interesting. It's very interesting how it is, sometimes our mind says something, but we often say this, but my gut instincts tells me that this is what it is. That is not your gut instinct. It's a part of who you are. So the gut is a kind of a emotional brain. This is interesting for us to know. A lot of current researchers, if you study the Lancet, if you study the recent allopathic researches, you will find that microbes influence inflammation. Microbes influence diseases like Alzheimer's, autism, chronic inflammatory diseases. So there's a lot of connection of microbes and diseases. We know about this as well. So what are bowel nosodes? I'm just going to give you, first of all, what are bowel nosodes? Okay. And of course, it would be the best for me to talk to you about how bowel nosode came into existence, what was the history of bowel nosode, and how the great Edward Bach and his family and John Patterson brought it into homeopathy, how he was introduced into homeopathy. But we will discuss about this so much in depth when we have a much longer session on nosodes, sarcodes, and bowel nosodes. So this was a gentleman because of whom now we are using bowel nosode. But I'm going to come to the clinical part of it. Mainly in my practice, these are the main 7 or 8 bowel nosodes. The Morgan Pure, Morgan Gardner, Proteus, dysentery compound, psychotic compound, Bacillus number 7, E. coli. These are the main bowel nosodes in clinical practice for me. Now, how to know when that bowel nosode is needed? First question. How do I know, oh, this is a case? How do I really know that a bowel nosode is needed? So after studying a few cases, me and my colleagues and my teachers studying their cases, my teachers' cases, my cases, we brought together a few patterns that can be found in cases where a bowel nosode may be needed. The first thing is recurrent infections. In cases where there are recurrent gut infections, recurrent gut-related health issues, one of the important pattern would be bowel nosode. If someone says, whenever I get stressed, my stomach, my digestion is affected, consider that there could be a bowel nosode that's needed in the case. Patients who have a lot of food allergies, they say that I can't tolerate this, and that. I just can't tolerate gluten. I just can't tolerate lactose. I just can't tolerate this. In fact, even if I eat this, I have this digestive issues. Consider bowel nosode. So this is, in short, the patterns that I see in bowel nosode. This is what, and you have to understand, this is work in progress, but I'm just sharing with you till now what we've really understood about it. What about the mind state? What are the emotional patterns that you will see in bowel nosodes? The main emotional patterns that you will see, and I've seen this in most bowel nosode, is the feeling of being abandoned, the feeling of being forsaken, the feeling of not being appreciated, the feeling of wanting good opinion of others. This almost reminding you of remedies like natrum, magnesium, carbon, silica, basically remedies belonging to row 2 and row 3. When you see these patterns, you could also consider bowel nosodes. I understand this. Some of these ideas are comparatively newer. Some of you may be listening to this for the first time, but I want to tell you one thing, and I promise you one thing. If you know this Bowel Nosodes well, and if you use them well, the results are so beautiful that you will be amazed to know. And in fact, I was telling this to Judith and to Dorothy a few weeks back that I cannot imagine my homeopathic practice without Bowel Nosodes and Sarcodes, because some cases I just don't know what I would have done if I didn't know a Bowel Nosode, for example. What else can I tell you about Bowel Nosodes? Some more patterns that you will see. You will see a lot of lack of reaction. Another pattern that you will see in Bowel Nosode, and when do you use a Bowel Nosode, is in cases where well-selected remedy fails. There's also one more pattern I've seen in Bowel Nosodes, is that there's a lot of claustrophobia. There's a lot of suffocation as a theme in these Bowel Nosodes. So some more things I will just very quickly tell you about Bowel Nosode. There's a very nice, and all these work is done by our great masters. Alan has written a very nice article at the end of Alan's keynote. I'm sure all of you have Alan's keynote. If you open Alan's keynotes, and if you open the last few pages, you will see a very beautiful map. And in the map, you will see this I've directly picked up from Alan's keynote. If anyone of you have Alan's keynote, you can pick it up right away and you can see this. And you can see that what Alan has actually done is he has written about which Bowel nosode is comparable to which group of remedies. And that's why these Bowel nosodes can be used sometimes when these other well-known polycrest remedy fails. For example, sulfur. Sulfur, when sulfur or sulfur-like symptoms are there, but sulfur fails, think about Morgan Pure. Morgan Pure is the Bowel nosode. Okay, I'm going to write here Morgan Pure. When a lycopodium fails or lycopodium-like symptoms fail, a Bowel nosode is Morgan Gardner. It's very interesting, I'm telling you. Yeah. When argentum nitricum fails or gelsemium fails, think about a remedy, our remedy that we discussed, which all our patient looked like that, right? Argentum nitricum, silica, gelsemium, nervous, dysentery compound. When thuja or medorinum fails, think about psychotic compound. So this is a whole group of remedies which are remarkable in practice, and yeah, we will discuss a lot about it when we meet. Now let's talk a little bit about dysentery compound. I want to just give you a broad idea about what is dysentery compound and how I understand dysentery compound. First of all, one of the genius of dysentery compound. How do I understand dysentery compound in front of me in when there is a patient? The important word is nervousness. It will remind you a lot of gelsemium. It will remind you a lot of silica. They will have a lot of anticipatory diarrhea. A lot of it. What is the thing that you will not see? Dysentery compound will always have some kind of colic or pain along with this digestive patterns. Dysentery compound, and you can see here, has more than fear, they are also very excitable. They are very performance oriented. They are not only undeveloped like Baryta carbonicum. No, they are not fixed like silica. They are very excitable. They are very nervous. And that's why they remind me a little bit of Cinchona or Coffea cruda. Slightest thing and they will start trembling. Slightest thing and they'll get nervous. Slightest emotional change and they will start getting urticaria. They will start itching. This is also dysentery compound. They have a lot of claustrophobia. Interestingly, gelsemium doesn't have claustrophobia. If you open the rubric fear of narrow places, you will not find gelsemium, but you will find dysentery compound. A very interesting rubric of dysentery compound is timidity, bashful with palpitations. The main sphere of action of dysentery compound is on the digestive sphere. Very often, the other thing I want to tell you, which is a very big thing in dysentery compound, I want to tell you, is there is a very, very big, I'm using the word here, there is a very big burnout, very big burnout. You're seeing patients with a lot of burnout, a lot of mental strain, causing a lot of digestive problems. Suddenly he's diagnosed of IBS or ulcerative colitis because of a lot of mental strain, lot of work pressure. Consider and study a bowel nosode like dysentery compound in that case. It's so common in today's times, in today's corporate world, in today's rat race. Think about bowel nosode. There's a lot of craving for junk food in dysentery compound, like fats, salt, sugar. They have very often chronic indigestion for a very long time. A lot of heartburn, acid reflux. A lot of irritations. And this irritation will keep happening for the longest of time. Could often have colitis, could often have cholelithiasis, gallstones. But a very important concomitant is a history of diarrhea or history of dysentery. A lot of fears, typically fear in trains and fear in theaters, fear in lift. Think about dysentery compound. Reminds you a little bit of medorinum also. They have a lot of brain fatigue, like picric acid, loses the train of ideas from interruption. Like this situation, Judith, I'm talking to you, I'm doing this webinar, but suddenly there is a noise coming, someone is joining, someone is joining, someone is joining. And if I was a dysentery compound, I would just forget what to say next. This is a symptom of dysentery compound. Loses the train of ideas from interruption because it's like an interruption. This is typical symptom of dysentery compound. Oh, what was I about to say? Oh, this is dysentery compound. I think this you will remember. So what we normally don't know much about, not many homeopaths know about this. It's a very important remedy for urticaria and allergies. And typically it's affected by too much of emotions and too much of nervousness. This is also dysentery compound. And generally midnight, early morning aggravation, very chilly. Dysentery compound is very chilly and they are very claustrophobic, extremely claustrophobic. So this was a little bit about, I just gave you a little broad idea about dysentery compound. Now, because we are talking about dysentery compound and this is what we are talking about, generally, bowel nosodes, I generally use it classically in 30 potency. And I generally give dysentery compound, for example, in this case, dysentery compound 30C, I would give 4 pills 2 times a day for 2 days. This is the main remedy that I give. Of course, a little later, maybe other remedies were required. But generally, this is the potency that I use. This type of dose, this is called a split dose. Okay. This was started by a very great Indian homeopath. His name was Dr. Bholanath Chakraborty. Okay, was a great homeopath from India. He was a teacher of Dr. Farooq Master, Dr. Sankaran. He was a teacher of teachers. This particular gentleman, he's of course no more with us, but he was a great homeopath, and he started this ancestral understanding of giving this type of dosage. This is called a split dosage, and this is what I often use also. But in the books, they write that you should generally use bowel nosode in 30 potency. But in my experience, I have used it in much higher potencies also. I have also used it in 30. I've used it in 200. I've used it in 1M. I've also used it in 10M. So I do believe if you have a remedy and the state matches that remedy and it matches very well and the intensity matches very well, and if you are confident enough, you can give higher potencies also. So anyways, this is what I gave. I gave dysentery compound 30, and I want to tell you that in the next few days, there was a remarkable change. This is a follow-up after a few weeks of dysentery compound, and you can see that his nail, his situation with the pain, the suffering that he went through, remarkably improved. So the Bowel nosodes are really revolutionary in understanding. They are, I think, forgotten treasures of homeopathy in today's times. I do believe that the more there is a need to do provings of these remedies again. I hope someone will do that. And I do believe that if we study them well, a lot of our blocked cases in some sphere will open up and we can help the patients even more. A little bit more about bowel nosode, which I want to talk to you about, is that generally bowel nosode can be used in following ways. First, in very complicated case, you could open the case with bowel nosode because if there are not clear indications for the remedy. Second, bowel nosode could actually be the deeper remedy, or in your words, constitutional remedy. I have cases where I have only given dysentery compound, only given psychotic compound, or given only Morgan pure. I have cases like that. And the third thing, which is more common, is where you might give a bowel nosode. You might have to wait for a few weeks to observe new symptoms and then give a much deeper indicated remedy. So these are the possible strategies that I have seen in cases of bowel nosodes. This is just in summary of one of the cases that I wanted to share where the main remedy prescribed was how beautifully dysentery compound helped. I think we still have a few more minutes. I'm going to share some more cases, and I think what would be the best is towards the end, we can keep the last 20 minutes for question and answer so that we can get the best time out of showing some cases. Let's go to the next case. Okay. Perfect. So this is a case. This is a case of a lady. The case of a lady with endometriosis in a 37-year-old lady. And you can see this lady I saw in Brazil a few years back. You can see the MRI shows deep endometriosis in different compartments. And even the MRI of the pelvis shows the endometriosis. When I studied this case in detail, and her main symptom was the primary infertility that she came up with, and she had even tried IVF, which was not helping. And even the doctor's gynecology said that it looks very difficult, even with IVF, that you will be able to conceive with this endometriosis. She came across as a very close person and she was really not opening up in the case. So what happened? What we analyzed, what we saw was the main pattern in the case. I told you I gave a lot of importance to past history of illness. In the past history, interestingly, we found out she had autoimmune thyroiditis as well, and even her sister had autoimmune diseases. Her other sisters also had endometriosis. So there was a lot of, you can see here, a lot of patterns of these hormonal and autoimmune diseases in her family. This is what I could make out. At this moment, I try to understand her physical generals. And I found that she was very chilly. She didn't like thunderstorms. She was very scared of thunderstorm. She loves snacks a lot. She would be eating a lot of snacks, a lot of junk food. She talks a lot during sleep. And when I started asking her, tell me a little bit about yourself, your basic nature, temperament. I also saw that as a person, she was very closed, very quiet, and she was not opening up. And I had to, really ask direct questions and really push her to answer more and to talk more, to really for me to understand the deepest level within. There was a lot of hopelessness for her. She felt that nothing can be done. And homeopathy also was like a last kind of a, what you can say, last trial, if I can say that. I'm sure all of us already know that many patients often come to us as a last resort. I continued focusing more on her state, and I understood that there were many fears, fears of death, fears of robbers, especially fears of unknown. In many such hormonal cases, I give a lot of importance to past history of illnesses. What do I mean by this? I'm going to share with you in short. So, what I do, and we see a lot of hormonal cases in Mumbai in my clinic. I generally see about anywhere between 30 to 40 patients a day in my clinic here in Mumbai. And of course, I'm very fortunate. We have a very nice team of doctors who work with me. Um, I'm also lucky enough to see patients from different parts of the world. This gives me experiences to know that there may be slightly different strategies, different potencies, different repetitions may be needed in patients who are in Asia, in India, and little different in Europe and South America and other parts of the world. So there are many of these discrepancies which I have seen in patients. What I often do in hormonal cases is that I try to ask, when was the first time the symptoms started? Once I get that, I try to go a little deeper. I try to go towards what happened before the symptoms started. And once I know that, I try to go much deeper about and focus in that area. So, in hormonal cases, especially in hormonal cases and autoimmune cases, try to base your prescription more on the crisis before the event and what was the core experience before. Don't try to go in childhood and break your head. Try to focus at just before the pattern started, and you will often find a very, very deep remedy there. This is just an experience, and I'm sure that you will be able to kind of replicate and share some things with us, hopefully. So now I'm asking, what happened before all these problems of yours started? She said, well, I was in a relationship. The relationship kind of broke. But what happened was, as soon as the relationship broke, within the 3 or 4 days, I found that the particular my ex-partner was with another girl. And this was something that I didn't expect. And my heart was broken. And somewhere I felt as if I was missing that person. There was a lot of feeling of, I wish this person was with me. Although I knew that what happened was for good, but this feeling was very strong for me, she says. During the same time, my dog died. I wasn't able to sleep. I missed my dog. Rely on him. He used to follow me everywhere. He used to be with me. He was like a child for me. Similarly, around the same time, my grandmother passed away. And I felt so hopeless thinking about this. I felt totally annoyed. And totally, my feeling was I was missing my grandmother. I wish my grandmother was there with me. I wish she was there. How I wish that I could crave my grandmother. I wish she was there. So, this was the main pattern what we could find in the case. Other than that, most of the symptoms were fairly common. Now, when I studied her case, how do I find a remedy for her? When I studied her case, hmm, what I really found was that her inner pattern was that of missing her boyfriend, missing her dog, missing her grandmother, the feeling of that one-to-one connect, that one-to-one kind of connection as a feeling of nostalgia, craving for that person. I wish that person was with me. That kind of missing was very, very strong in her case. Of course, along with that, her chilliness, her fear of thunderstorms, her desire for snacks, her sweat related symptoms, and her migraine confirmed the remedy for me. Well, the remedy was straightforward at that point for me, and the remedy I gave was natrum carbonicum. And you can see very clear cut symptomatology of natrum carb. But the only thing is that I did not give her natrum carb. Why? So this is something that I want to tell you. In cases, and I'm showing here, in cases of infertility, in cases of endometriosis, what I often found was if you give the indicated remedy, in cases where there has been too many hormonal treatments done, okay, too much of estrogen has been taken, too much of IVF treatment has been taken, too much of OC pills have been taken, too many homeopathic remedies have been taken. The indicated remedy will not help so much. And I failed for quite a few years till I could find and till I could understand that in many cases, in many complicated cases, Sarcodes are needed. And in many complicated cases, Sarcodes may be the main remedies. And in some cases, the Sarcodes may be followed by the deeper indicated remedies. So first of all, let us talk a little bit about Sarcodes. What means Sarcodes? So Sarcodes, as you know, are remedies which are prepared from healthy living tissues. For example, a very well-known remedy is thyroidinum, although it's prepared from the thyroid gland of the sheep. Okay, it's not from the human being; it's from thyroid gland of the sheep. Similarly, we have many Sarcodes. Huh? We have remedies like insulinum, uforinum. Uforinum is prepared from ovaries. Master Burnett was the first homeopath to use uforinum in 6 potency in cases of menopausal flushing. So, what are the main patterns of Sarcodes? First of all, in cases where you can see that there are two states, one state is of a clearly indicated individual state, whatever the state is. For example, natrum carb, for example, calcarea carb, for example, lachesis, the indicated state. But sometimes superimposed on it, you can see a hormonal layer. You could actually see a lot of symptoms of the hormones. Like in this case, she was putting on a lot of weight. There was a lot of obesity. There was a lot of menstrual symptoms. There was a buffalo hump, hormonal symptoms, symptoms due to taking a lot of estrogen and so many of these hormonal tablets, hair fall, so many other symptoms. So when you see this kind of clear hormonal patterns, this is where you would start thinking about this could be a need for a sarcode. Sarcode could often be deeper remedies. Sarcodes could often be intercurrent remedies also. Sarcode could often be phasic remedies also. Sarcodes are remedies that can stimulate that particular organ, that can stimulate particular enzymes, that can stimulate particular hormones. One of the important patterns about sarcodes, and we will talk about it, is that they are very fast paced people. People who are sarcodes generally, I have seen, they are very fast. They are very overactive. There is a lot of burnout state, and they are people who want to do things beyond themselves, people who sacrifice themselves, people who overdo it. This is a pattern that you will see in many sarcode patients. Of course, in some cases you may not see that pattern also, but this is a common pattern you will see. For example, cortisone. In cortisone, the remedy in the you can read about this from Julian's Materia Medica or in Murphy Materia Medica. You will see that if someone is going slow, they can't tolerate it. They will say, why are you going slow? Go fast. Let's go, let's go, let's go, let's go, let's go. This is cortisone. They cannot handle people going slow. Yeah, because that is the state of cortisone. Because they are very enthusiastic, bubbly, full of life, and constantly wanting to uplift their mood. This is cortisol. Very passionate. And the other time where you could often use Sarcodes is when there is a lot of lack of reaction, when there is a developmental delay, growth delay, slowness. For example, body is not growing. Very often they bring children to us and the height is not growing. Very often I give pituitary gland in such cases. Sometimes they bring children where the sexual development is not happening. There you can consider remedies like testosterone, testis 30. So there are many of these different Sarcodes that we use. Of course, we will go in depth about all the Sarcodes when we meet in person. So what did I give in this case? We already know what I gave. Um, so the remedy, the Sarcode in this case, which I gave, was a Sarcode that I use a lot. It's folliculinum. So my prescription in this case, just to tell you before we discuss folliculinum, was, I'm going to write here. What I often do is in a very complex case, I might give Sarcode, wait for a few days, and then give the deeper indicated remedy. So in this case, the Sarcode of choice was folliculinum. We will discuss why. And after a few days, then I give natural flower. So what is folliculinum? Let's talk a little bit about folliculinum. So first of all, folliculinum is a hormone. It's a remedy prepared from, secreted from the ovaries. The homeopathic point of view, folliculinum, and you can read about this from two articles. There are two beautiful articles about folliculinum, and you can read about this from British Homeopathic Journal, and one of the author was Hui. I'm writing here. One of the author was, yeah, wow, this is one of the authors whose writings you can read. The state of folliculinum is somewhere between lac caninum and sepia, where you will see a lot of feeling of being controlled, being dominated by someone, feeling abused, feeling as if they have suppressed their individuality for someone else to please the person who's dominating them so that they can feel accepted. There is a lot of emotional drain, there's an emotional burnout on one hand. On another hand, they feel totally shut off. They feel like wanting to go away, shut off, and they develop an entire indifference toward that person. So there is these kind of dual states in folliculinum. On one side, they feel controlled, they feel abused, they feel dominated, they feel they want to be accepted, and on other side, they feel wanting to shut off from them and just go away. So they have this dual state in folliculinum. That's why they may look a mix of lac caninum and sepia. What are the important rubrics of folliculinum? Of course, the feeling of being dominated. Delusion is under powerful influence. This is a very important rubric of folliculinum. Confusion to identity, very important rubric of folliculinum. Very sensitive, folliculinum. Of course, folliculinum is very important for climacteric pathology also. Many menopausal women need folliculinum in 30 potency. The dryness, the dullness, the dryness of the genitals, the atrophy, itching, a lot of itching in the vagina, typical for folliculinum. I use this remedy a lot as an intercurrent in cases of polycystic ovarian disease, thyroid, endometriosis, fibroids. One very peculiar symptom that I've confirmed in most cases is there's a lot of craving for different type of food and typically carbohydrates before menses. Too much craving. They become obsessed about eating different food before menses. This is very typical for folliculinum. Acne before and after menses, folliculinum. A lot of literature also show there is a link between carcinosin and folliculinum, which means they look also similar at times. Sometimes they also said that folliculinum and carcinosin are complementary to each other. Many carcinosin patients later on may require folliculinum. Many folliculinum patients later on may require carcinosin. It's very interesting. The research is done by in the journal in the British Homeopathic Journal. This is a very important rubric, this very important dream of folliculinum that I have clinically confirmed. In fact, I saw a patient who had the same dream today. Dreams of being pursued. This is a very important symptom of folliculinum. They feel that they are being pursued. Someone is following. Someone is trying to molest them. Someone is behind them. And she's trying to run, but she's unable to. This is a key. And in this rubric has only one remedy, folliculinum. And I would like to show you that in the repertory. You can see dreams of being pursued. So, this is a little bit about folliculinum. Some very important concomitant symptoms. A lot of symptoms aggravated from ovulation to menses. All the symptoms are better during menses, reminds you of lachesis, feels better in fresh air, a lot of spotting. These are also all concomitant symptoms. So that's what I gave. I'm going to show you here. I gave folliculinum 30 for 2 days, wait for 2 days, followed by natrum carb 1m, LM2. And this particular thing I repeated every 45 days. Some good news that within the next 2 follow-ups, that is in the next 4 months, we did the test and we found quite gladly that her urine pregnancy test was positive and she was doing very well. This is her sonography in the first follow-up where the first trimester of pregnancy, all parameters were well maintained and she was doing very well. And we followed up even during pregnancy. This is very important. Just giving the Sarcode, just giving the indicated remedy doesn't mean we stop. During the pregnancy also, we manage all the symptoms that women may undergo during pregnancy, whether it's hemorrhoids, nausea during pregnancy, with help of homeopathy, because homeopathy is allied to nature. And you can see how beautifully her baby was delivered, and this is her healthy homeopathic baby, delivered so well, thanks to homeopathy, in a Brazilian dress, very happy. And the mother and the child are very happy, very healthy. We have followed up with them, and very good news. Another homeopathic baby, because so many countless children homeopathy has helped in mothers who are not able to conceive, and Sarcodes are so important. I want to tell you, recently I had a case where nothing could be done. It was a lady who was menopausal and she was not able to conceive. With help of Sarcode, she was able to conceive. So this Sarcodes can actually help us go to a level where a lot of cases which we clinically feel are incurable can actually be really very beautifully uh, solved. So this is a little bit about the remedy folliculinum. I'm going to tell you one or two cases. I'm wondering if we still have some more time. Yeah, I think we have time. Judith?
Yes, you
Sure.
have another 25 minutes.
Okay, maybe I can show one or two short cases. Is that okay, Judith? And we keep the last 15 minutes for question and answer. Is that okay?
Sure, take your time.
Yeah.
And also take a sip of water.
Cough after drinking water, ameliorate. Normally we think causticum, cuprum, drosera. There's one more very nice Indian remedy. I'm going to write it for you here that we use a lot. And I'm going to write here. I'm wondering how do I write? Yeah. Is Cassia sophera. This is another very interesting remedy. Cassia sophera, very good for this. But if drinking cold water ameliorate, and actually this is a little cold water, this is just for your interest. If drinking cold water ameliorate whooping cough, then the remedy is Coccus cacti. Interesting. The reason I'm telling you this out of nowhere is because we will keep discussing Nosodes, Sarcode, Bowel Nosode, but don't forget the well-known remedies. Huh? Not at the not at forgetting the well-known remedies. You have to become like my teachers and all the great homeopaths used to do. You have to become a walking, talking materia medica. Okay. Only then the impossible we can really achieve together. Okay, let's come back. Let's do one case, very interesting case. This is a case of the patient's relative called me up and told me that the child is admitted in the hospital. He has a subarachnoid hemorrhage. He has a head injury, and of course, head injury. So arnica, gelsemium, natrum sulf, all this was given, and he was just not coming into consciousness. And you can see his reports. This is his reports in the investigations, and shows there is a subarachnoid hemorrhage. I hope you can see this. Young boy, but he's not coming to consciousness. So I just studied his case. I studied the repertory, I studied his case, and I just put head injury and unconsciousness or coma. And when I started studying this, I started studying all the kind of rubrics for this particular pathology. And when I found the main remedy that I found in this uh, rubric was pituitary gland. Yeah, that's what I found. Pituitary. This pituitary gland is a very, very, very important sarcode. If you're treating a case of brain related pathology, and you can see here cerebral hemorrhage, there are certain clots in the brain, there are certain hemorrhage in the brain, and the brain stops acting. One of the first remedies I normally think about is pituitary gland. That's what I gave. I gave pituitary gland 30 to this particular child. In such cases, also, one of the ways to do this is we always often use olfaction, or you may rub the remedy on the wrist, ankle, and forehead. In India, we are very lucky that very often we are invited in allopathic hospitals where we can treat home with help of homeopathy. And very nicely, within the next 3 to 4 days, the child was gradually be able to come out of the unconsciousness. He was brought home in 48 hours after pituitary gland. So this is another remarkably interesting case where we have given pituitary gland and pituitary from pituitary. And we have three main remedies from pituitary. I'm going to write it for you here. Pituitary has three main remedy. One of the remedies pituitary gland. This is the main remedy in children's cases which I use for developmental delay. It's maybe I will share many cases about this. This is a very important remedy for children with developmental delay, hyperactive children, restless children who are not improving, and very slowness in understanding, very lot of slowness in grasping things. Body is not developing, sexual organs are not developing. A huge developmental delay may require pituitary gland 30 as a very important remedy in clinical practice. The other remedy from pituitary gland is pituitary anterior. Okay, and there are certain set of hormones that pituitary anterior secretes. Out of all of them, the remedy pituitary anterior I use in 30 potency also, but mainly I have used this remedy in autoimmune thyroid cases. In thyroid cases, when all remedies fail, generally I use pituitary anterior with very interesting cases, very interesting result. The other remedy is pituitary posterior. This remedy secretes oxytocin and vasopressin, okay, and generally is very important for post-pregnancy problems. So these are the three remedies that we have from pituitary. Um, this was a little bit I want to tell you. So pituitary gland is a remarkable remedy in practice. I use this a remedy a lot, and a very good book to read about this is from Alexander Blackwood. If you're treating a case of an old man and there is suddenly the blood pressure goes high and there is a lot of dizziness and vertigo and there is spasm in the chest, think about pituitary. Even in stroke cases, we use this remedy a lot, even in cases of stroke. Finally, it's also very important remedy. Suppose you're treating a case of a woman during pregnancy and she's not getting the pains, she's not getting the parturition pains, the labor pains. Pituitary gland, like opium, can stimulate to very nicely get the pains. You can read about this from Boric. I'm going to read it for you. See what's written. Second line. Pituitary, and everything is written in books. All great work has been done by our masters Hahnemann, Clark, Dunham, Tyler. All of them have done great work. We just have to read it and apply. That is our work as homeopaths. Pituitary exercises superior control over growth and development of sexual organs, stimulate muscular activity, overcomes uterine inertia. So very good remedy for women for labor pains when it's not happening. So this is another of the very interesting um, kind of remedy. I have quite a few more cases that I have prepared, but I think I'm going to kind of stop for the last 15 minutes because then I wouldn't be able to do justice for the question and answers and things like that. I have, like my colleague said, I have written a few books. I've written 6 books and just trying to finish my 7th book, which is on my table. And I hope that when I come to Netherlands, this book I will be able to give to Judith and to Frank. This is the next book that I'm writing. I hope I finish it. So yeah, these are the books I've written: Decoding Mental Rubrics, Nosodes, Sarcodes, Acutes, Value of Repertory. This is my latest book, Homeopathy for Hormonal Healing in Women, where so many different women's health related issues, including infertility, polycystic ovarian disease, menopausal, palliative care. I've tried to put it in clinical experience. And of course, I want to invite all of you, wherever you are, for our session in Netherlands. Thanks to the academy who has invited me. What we will be doing when I come there, because we will be having at least a total of 12 hours is what I will be trying to share with you about 25 to 30 odd cases and and try to go through each case and try to share with you about all the 30 remedies. So it will be great if you can join us in person, it will be great. But if you can't come in person, definitely join online as Judith has already announced. And maybe it would be great to interact with you. And I look forward to learn from you also. If there are some questions, maybe it's a good time to take some questions. This is my email ID. If there are some questions, some thoughts, anything you want to share, or maybe you want to share your experiences with me, I'm happy to learn from all of you. This is my email ID. I want to thank my colleague, Dr. Jaya, who has helped me with this presentation. And of course, I also want to thank my friend Deanne, who's from Netherlands, who's helped me to collaborate with our friends here. Let's take some questions.
Gaurang.
Yeah.
There is a question from Catherine Merlet.
Okay.
Have you seen certain bowel nosodes by using in diabetes, a thyroid autoimmune such as Hashimoto? It's 13 past 8 that she asked the question.
Yes. Catherine, how are you? I hope you're well. Catherine is a regular participant and in our courses, and we know each other well. I hope you're well. So, Catherine, in diabetes, the most important bowel nosode that I would consider is a bowel nosode Gartner. But of course, we need to see if all the indications of Gartner matches the state. In autoimmune thyroiditis, till now I haven't used a Sarcode, but I would want you to consider anterior pituitary because it's a very, very, very interesting message. Very, very interesting remedy in Hashimoto's. Pituitary gland and colophylum for encouraging labor pains in pregnancy. Well, there are 3-4 remedies in labor pains. I'm going to try to differentiate it for you. Pituitary gland, colophylum, simicifuga, opium, pulsatilla, coffee. I think it's very clear. In coffee, you will see the overexcitement in the woman. A lot of overexcitement. Insomnia may be a concomitant symptom. In opium, there'll be a total lack of reaction. Just nothing is working out. There is just no pains. Yeah. Simicifuga and colophylum will have the concomitant pains. In simicifuga, you'll see a lot of history of lot of dysmenorrhea. Right? And in colophylum, you'll see a lot of hip pains. Yeah? And in colophylum, you'll see sudden shifting of pains. Pituitary gland generally I use when all remedies fail. Sarcodes are remedies generally you use when all well indicated remedies. So this is a little bit I wanted to share with you. Yeah.
Gaurang, there's 2 more questions. Can you see them or shall I read them?
Yes, I will read it. No problem. No problem. There is Radhika. Hello, Radhika. So which Sarcode can we think in case of children with delayed milestone and other milestone time? Okay, that is the question. So I'm going to try to answer it in a more broader term. So developmental delay. Okay. I will try to do a little differential diagnosis. In developmental delay, as we discussed about, the main remedy is pituitary gland. This is the biggest remedy that I use. Um, although delayed speech, you want to consider, of course, well indicated common remedies also. Don't forget calcarea carb, don't forget phosphorus, don't forget calcarea phos. Don't forget what Kent says about agaricus. Huh? He says agaricus is the best remedy when there is slowness in walking and slowness in speech. When it both is there, remember agaricus. So don't forget a well-known polychrist. My idea of doing this lecture is to give added experience about blocked cases, but don't forget well-known indicated remedies for newer remedies. Okay, that is something that I don't encourage. So do read that. So in delayed development, the number one remedy for me is pituitary gland. Right. The second remedy which I use a lot is the remedy DNA. This is a very important remedy. I use it in 30 potency. Generally in delayed development, where the mind is not developing. This is DNA, where the concentration is not there. This is DNA. The other remedy is RNA. RNA is a remedy where they are very hyperactive children who sleep a lot, who eat a lot, and they eat sweets a lot. It's a very important remedy, RNA. Of course, the references for this is O.A. Julian's Materia Medica. You can read everything there. The other very important remedy for this again is thyroid enema. And in that also in very high potencies you can consider. Here, the speech is not developed, but along with that, even the body is not developed so well. Consider remedies like thalamus also, thalamus and hypothalamus. These are remedies also you could consider. Of course, you want to study them so much more in detail. I may not have enough time to exactly teach you each remedy today, but maybe we will discuss about it when we meet in Netherlands, hopefully. There is one more question. I don't know the name of this gentleman. Can homeopathy treat chronic bacterial prostatitis? Absolutely, yes. Which nosode and treatment would be best? Well, the best remedy is the indicated remedy. There are some more questions. Should I go through all the questions myself and try to answer? Is that okay?
Yeah.
Yeah. Okay. So there's one question. Hypothyroidism after COVID in one patient. Any particular thoughts? Vidhi, no particular thoughts, but it's worth considering. Is it after COVID or after COVID vaccination? Because everything will change based on that. Dr. Vidya, hello sir. Which Sarcode we use in? I think she's asking about cerebral palsy. Well, I already gave you a differential diagnosis for developmental delay. You can use that. Next question from Parshwa. Which potency can you use in intercurrent? Yeah, it's a good question. Again, it's a long topic for me to talk about potency. The most important thing I want to tell you is that there is no fixed rule. Okay. For example, I'm going to tell you pancreatinum, which is a very important remedy in my practice for acid reflux. And pancreatinum, interestingly, is prepared from the pancreas of the sheep. So it has a lot of symptoms like lac ovis. Okay. So they are very dominated, they are very mild, very, very shy, very withdrawn, and they have a lot of acid reflux. This I've seen best in 6 and 30 potency. Interesting, no? On the other hand, a remedy like medorinum, which you know very, very well, can work the best in very high potencies. I have seen some amazing results when I have given 1M, etc. So the idea is for different remedies, different potencies may be the best ones, and it also depends on the type of case and the level of prescription. I hope I try to give you a little idea, and we will of course share with you more. Brett writes, can I schedule a consultation about your young daughter? Hello, Brett. Of course, I will try to help as much as my limited knowledge I can help you. This is my email ID, gaurang@gmail.com. You can, of course, write to me and we will try to study your case. Okay. Then there is, what about muscular? Any hints for that? Muscular dystrophy, Dr. Vidya, is very difficult and there is limited scope in it. One of my colleague, not myself, but one of my colleague had very good experience in this. His name is Dr. Rasal. You can just Google his work on YouTube. He has a good experience on this. I think he would be in a better place to answer this than me. Anna writes, which nosode would you consider in reactive arthritis with eye problem with scleritis? Hello, Anna. Again, now, if you're talking about a reactive arthritis with scleritis, and if there is an autoimmune component, you have to find the individual remedy. And when you say which nosode, it's a good idea to find the deeper miasm. You can find the deeper miasm, you can find a remedy based on that. Okay, there's some more questions. Karine Daniels has joined us. Hello, Karine. Finally, good to see you. When would you use Sarcodes in 3x and 6x potency? Okay, I will try to answer. See, long story short, okay, when to use low potency, when to use high potency. Let's first start with this. Generally, low potency I use when the level of prescription is totally pathological. If it's a totally pathological prescription, for example, if someone just has a lot of burning in the chest all the time, has an acid reflux all the time, acid and burning, and there is no other symptom, I will give him pepsinum in, let's say, 3x. Okay, it's very low potency. On the other hand, on the other hand, if I see a patient, okay, recently, if I see a patient who has very, very bad psoriasis and who's putting on a lot of weight, is becoming obese, okay, is very violent, is itching a lot, all symptoms are aggravated before menses, right? Has a lot of impulse to suddenly kill or get angry. These are all typical symptoms of proving of thyroid in him. Then I will give it in a high potency, maybe 200 or 1 m. So depending on the level of the case and the type of prescription and the 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 area at which you are prescribing, your potency will change. So that's a little bit of idea I wanted to. Mansi asks, during our in-person session, can we discuss your way of case taking? Of course, Mansi, we will try to see the best that we can do in the time that we have, Mansi. Okay, let's see if there are any other questions, or maybe Judith, you want to say something about our session, what we are planning, how do they kind of join us or anything?
Yeah, I think it's it's time to round off by now. As I know, it's almost midnight in India.
Yeah,
So
it's 12 o'clock, but for homeopathy, we can be awake till post midnight.
oh, you can. Okay, well, thanks anyway for putting so much effort in this webinar.
With pleasure.
And thank you for the beautiful cases and insight, and yeah, with happy endings.
Yeah.
So I think it's good to close the evening now. So thank you all for joining us tonight, and we hope you find Dr. Gaurang Gaikwad's insights inspiring and valuable. So whether this was your first introduction to his work or you followed him for some time, we trust this session has deepened your understanding of Nosodes and Sarcodes. As mentioned, Dr. Gaikwad will be with us in the Netherlands on November 14th and 15th for an in-depth seminar where you can attend in person or online. The registration link is in the chat. We look forward to seeing many of you there. And for now, have a wonderful evening. Once again, thank you, Gaurang.
Thank you.
And for sharing your time and knowledge with us.
Thank you for making me part of this. Thank you.
Thank you, Gaurang.
Good night, everyone.